record. So we will start with the subjective ways to assess or interrogate validity. Subjective means it comes from us. It's not sort of out in the world somewhere. It is something that we as scientists invent and hope that it is going to work. And then we have 3 empirical ways or objective ways to assess validity, right? In this case, we have to conduct actual studies. They don't have to be experiments. Remember, experiments and correlation studies are different because there is no internal validity involved in correlational association claims. And these 3 are criterion, convergent, and discriminant validities. And hopefully we'll get back to quickly to see some of the questions from your quiz too. Okay, so this is the main question of any science. Are we studying what we think we are studying? So, and for some of these examples here, it's really easy. So could you say that running speed is a valid measure for depression in elderly adults? Of course not, you would say. Well, who cares whether they can run? You could perhaps change it and say, is running speed a valid measure of elderly adults' health? That is a more sort of meaningful way of asking this question, but still, we don't ask elderly people to run. So validity of these 2 potential claims or hypotheses is not going to be great because that's not how you measure depression. Now, the next one is also very similar. If you have people's shoe size, does it correlate with intelligence? That is, if you have larger feet, you're more intelligent. Well, again, we know that intelligence doesn't really have to do with physical characteristics like this. So there's going to be no validity at all in measuring intelligence using the shoe size. Now, personality measures, I'm sure all of you or some of you are familiar with the Big 5, right? Does anybody know what the Big 5 stands for?
No.
Interesting. The Big 5 is Briggs-Myers. Briggs-Myers. I can't spell today. Myers assessment of personality. So, for example, avertness. How overt are you? Or openness, I think. Openness. How open are you to new experiences in life? It's also about conscientiousness. Are you a conscientious person? What else? Extrovert, introvert, right? Are you more social? Are you less social? Anxiety, not anxiety, neuroticism, right? How neurotic are you? So there are 5 big personality traits, and you can take a questionnaire like this on the web. It's not necessarily the right one. It's not necessarily the scientific one, but there are plenty of. And that will supposedly tell you how far, let's say, on neuroticism you are. Are you a neurotic person, or are you a very sort of stable person, and so on. Again, how do you measure this? How do you measure somebody's conscientiousness or somebody's openness? It's hard. We have to create something giving us the subjective validity. Subjective from the point of view of psychological science. All right. So here is a question just before we get into more on different types of validities. This is the question from your quiz too. And let's see if you guys can answer that question correctly. Type in the letter in the chat that you think is the answer to this question. Okay, everybody says A. You're sure? Who remembers the 3 reliability types that we discussed last time? And it's also in the textbook. So the first one is test retest reliability. Test retest. Could that be test retest reliability? Because A is reliability. Think about it. Test retest means that the same assessment, scale, measure, instrument, all of these mean the same thing, was applied to the same group of participants twice at 2 different times. Now, Dr. Smith only applied her teaching effectiveness questionnaire once. So test retest reliability is not going to work for us. How about inter-rater reliability? Rater. Could that be the reliability? No, because inter-rater means there are 2 different raters. So she rates students, or students rate her on teaching effectiveness, and then another group of students rates her as well using the same instrument. So that can't be inter-rater reliability. So what's left is internal reliability, where you have to take a questionnaire and split it in 2 and make sure that each part delivers similar results and not the opposite results. So out of 3 reliabilities that are available to us, none of them applies to this question. So A cannot be the answer. Now, a couple of people say C. Do we have any information about what kinds of variables were measured by her questionnaire? For an interval scale, it has to be a quantitative variable, that is a number. There's nothing here in this question about numbers or anything. It gives us no information about whether the variable is internal reliability, Jasmine.
Thank you.
Mm-hmm. The internal reliability. Um, so we can't assess variables here. They're not given to us. All we know that there are some ratings. But if ratings are agree, disagree, they can't be measured on the interval scale, right? There's also nothing about statistics here. So what's the correct answer? D, right? Because, yes, thank you guys. Look, because she wonders whether they indicate how much the students learn in her class. So the questions that she created, or a test that she created, or whatever she created, that test should show her that the students learned. And that is validity, of course. Is it a valid instrument to measure teaching effectiveness? So that was one of the questions from your quiz too. Of course, you could have gotten at any point in the quiz because the questions are randomized. All right, so let's look at the first one, construct validity. Yes, it's a little abstract, but try to think about it. If we have an abstract concept of which we have tons, I see that, Jeremy. That's okay. There is a strategy. If you want, I can teach you that strategy. So any abstract concept. So can somebody quickly type in the chat one of the abstract concepts that we have discussed or that you can think of? It has to be abstract. That means we would need to operationalize it to work with that. Could be an example from the textbook. Could be something we discussed. I want an abstract concept. Oh, one of the examples that we discussed some time ago was love. Love is an abstract concept. So now if you want to know about people romantic involvements, you have to create questions in such a way that they do measure love and not something else, not even affection, not friendship, but love. That's what is meant here by association with specific theoretical construct, because love is a theoretical construct from the point of view of psychology. Then we have to come up with an operational definition, of which we have three, right? Self-report, observational measures, and physiological measures. We could do all three if we want. Okay, so there's another one here for you, aggression. Does anybody remember what is the abstract phenomenon concept that's being discussed in chapter 5? I bet many of you are interested in that particular concept. Yeah, nobody remembers? Depression. Depression is a big topic in chapter 5. So how do you measure depression? If you have a particular assessment, does it have construct validity? Is it going to give us a depression number that reflects our participants or our patients' feelings, right? That he or she is depressed. Okay. So we talked about Rosenberg's self-esteem scale, which only has 10 questions last time, and this is Beck's depression inventory, BDI, that has been in use in clinical and cognitive psychology from 1960s. Okay, we'll come back to BDI in a minute. The problem is, again, we cannot measure depression directly. There is no machine that you can be hooked up to and then the machine would say, oops, you're depressed. We don't have that. We do have some ways of perhaps getting certain physiological measures from neuroimaging. But that's not really possible for massive screening of populations. We need something that's could be administered cheaply at any time. And to do that, we create these questionnaires, surveys, assessments, inventories, measures, scales, all of that. And then we have to make sure that they have, first of all, construct validity. Okay, so the two, we're not going to talk about some of these guys, but we'll start with the subjective judgments, all right? Face and content validity. They're very similar to each other in a way. The only difference is that face is the one that actually says, do you measure depression with BDI, or do you measure something else? Do you measure self-esteem with while content has to make sure that everything that needs to be included is included. That's a, yes, Didi, absolutely. Freedom is an abstract concept. Sorry that I just noticed your question. Yes. So if one wanted to define freedom with using operational definition, is freedom uh, an ability to express your opinion without being persecuted? Is freedom e- equals to your ability to leave the country and go abroad? What are all these? Would that be being able to go abroad? Is that a good measure of, is it a good construct validity measure? When I can tell you, when I grew up in the Soviet Union, which was long ago, um, not only we had to have an entrance visa, that is, if you want to go somewhere to a country anywhere in the world, including the United States, you would have to have a visa from the American embassy. That's fine. A lot of countries still do that. But we also had what was known an exit visa. So I couldn't just go to the airport and say, I'll buy a ticket and fly somewhere. No, I had to get permission from the government, and that would actually be a stamp in my passport. One day, if we have time, I'll show you my Soviet passport. That allows me to leave the country. So is that a good measure of freedom? So we can ask all these questions. The point is, for face and content validity of all these assessments that we invented as psychologists, they all are subjective. That is, they all depend on us. So there is a huge potential for error, but there's also a huge potential for improving it. If we continue to, if we use BDI for almost 60 years, it's getting better, right? People improve on the questions in this assessment. All right. So here is an example from the textbook. Professor gives a class of 40 people his 5-item measure of conscientiousness. And I'm only giving you 3, just an example. So one of them is I get chores done right away, I follow a schedule, I do not make a mess of things, and so on. So now here's my question to you. Do you think that his items are a good measure of conscientiousness? Okay, Jeremiah says yes.
Professor, can I explain why I got yes?
Yes, yes,
Um,
yes.
because for one of the honor societies I'm in, we had to take the disc assessment, and I got conscientious. So like when I'm reading all the characteristics, it matches up with the definitions.
Good.
But
That means you're a conscientious person, right?
so like everything that it says right here, they have these as examples.
Well, yeah, but look, this is just a hypothetical example. It doesn't mean that conscientiousness is measured completely this way. You can imagine having 40 questions for conscientiousness, right?
Yes.
You, right. So this is just an example. It doesn't really mean that that's how you would measure consciousness. But in the sort of framework of this little discussion, yes, you're right. These items do measure conscientiousness. They're not measuring love. They're not measuring happiness or intelligence. So now my question to you, not just to you, of course, Jeremiah, but to everybody is which validity is it if it's a good measure of conscientiousness? Now, think back to the figure. Where is it? 136. All right. Which validity is it? So let me ask somebody if nobody volunteers. Internal. No, Seeger. No, not internal. We actually don't have an internal validity in that sense. Think of the internal validity as the third variable problem, right? This is not an experiment, so there is no causality here, really. Okay, Milana, are you with us? What's your thinking? Okay, Didi, this is not reliability. This is validity. Don't get the two things confused. Okay, Milana, let's go back to the description. Okay, I'm giving you a hint. This validity is one of these two. Yes, Jeremiah, but construct validity consists of these two things, face validity and content. So which one is it? Face, Romain. Yes, yes, face. Face, Milana. Because does it measure conscientiousness? Yes, these are not perfect questions, but they are about conscientiousness, right? And content is only if you have enough information to assess conscientiousness. And how do we deal with that? Well, we have to ask experts to help us with that. So the correct answer here is face. Yes. Thank you, Romain. Thank you, Milana. You guys are correct. Now let's continue. So now the same person sends his 5-item measure that you just saw of conscientiousness to 20 experts in personality psychology. So these are people who do personality stuff. He asks them if they think he has included all the important aspects of conscientiousness. Which validity is it? Content. Yes, Jenny. Excellent. Yes, Milana. Content. Because if he only has 5 questions and he thinks that he has done a good job looking at all aspects of conscientiousness, and of course, his content validity is going to be low because with 5 questions, you can't do that. You probably need more like 50. Good. So both of these are subjective. That is, people judge them. When we create a scale, we try to work with it. And then we ask other people and saying, do you think that's good? So if you decide to go for a survey in your assignment too, you may have to deal with the validity. Are you asking the right questions? Are you asking enough questions? Okay, let's do another quick example. So establishing construct validity, either face or content, either of the two, would probably be most important for which of the following? Now we have not each validity, but construct validity has these two components. So let's look at A. I mean, how do we measure blood pressure? We have a special gadget that we can buy in the pharmacy. Yes, beats per minute. You put it on your arm, you pump it, and then you get the readings. Okay, so is this measuring blood pressure with this gadget, is it valid? As long as the gadget is working properly, right? Yes, it does. It's not showing us 500 beats, right? So we don't need to establish construct validity because this is a physical phenomenon that sort of exists outside of our thinking. How about a measure of number of seizures a person has per week? Let's say we're talking about an epileptic patient. Is this something? The question, Romain, is not about the type of validity. It's whether you need construct validity at all. So can you, if you are a patient's caregiver, now the person has a seizure, you can count, right? 1 or 2 or 3, God forbid, more than that, but it's an actual number. There's nothing in your mind that needs to check that, because construct validity, can you measure seizures in numbers per week? Yes, you can. 0 seizures, person's fine. 1, that's a very low number. So there is no construct validity for B either, because it's measured by physical events. What about C? What's a religiosity? That's how religious somebody is. How do we measure person's religiosity? If I ask you, are you religious? Is that a way to assess religiosity? How often he
No.
prays? How
You'd ask
maybe?
if we go to church like every holy day, or as he said, do we pray, or do we
Right,
have
but
like crosses in our house?
right, Jasmine, but that might be a little bit more sort of operational definitions of
Oh,
religiosity, right? So no, you're right. You could say, I, as a researcher, will equal the number of crosses on the house to person's religiosity. Well, the only problem is that you're looking at Buddhists. They don't have any crosses, right? So you will be restricting yourself to, and sometimes people have crosses for other reasons, right? So religiosity cannot be measured with a blood pressure machine. Exactly, Victoria. It's not that we can't, it's very difficult. So here, this is the place where we need a questionnaire, where we need an assessment. And assessments are always created by psychologists or doctors, people who are trained to do so. So therefore, this is the one where we need to think about construct validity. Are we asking the right questions? Are we measuring religiosity? Are we measuring just the number of crosses in the house? That's very different. Now tell me about D. Do you think D needs to be assessed for construct validity as well? Right, Lewis. We don't need to. We just need to know body mass index. And if it's over 25, yeah, boom, you're overweight. If it's over 29, boom, you're obese. And this is very physical. You can put the person on a scale and weigh that person and then do the calculations. All right, I see that it is an issue for you guys. And of course, you need to know more about that. Okay, let's quickly look at the other 3 and then have a break and move on to assignment number 2. So now we are going to the objective measures. So going back to that, where are we? Okay. Going back to that schema, now we are here. So these 2 are subjective. Psychologists invent them. Psychologists ask other psychologists. Here we actually are looking at empirical evidence, and that's objective judgment. Oh, look at that. I just noticed that there is Irina in those 2 scatter plots. Ha, okay. So this is an example from the textbook about being a good salesperson. If somebody comes to your company in the good days when we had companies and say, I would like to be a salesperson for you, well, you can look at this person's resume, you can ask her what kind of education she has, but maybe you want to give her some kind of a test, all right? And the example in the textbook uses the intelligence, the IQ test, to predict whether the person is going to be a good salesperson. So as you can see on figure on the left, Irina is good. Wow, I'm bringing a lot of money. Look at that. But this correlation is not perfect. As you can see, the blue line is above the correlational line. And Alex, who's, so my IQ, Irina's IQ is between 20 and 130, and Alex's IQ is under 110, and he is producing less sales. And you can see there is a lot of spread among these dots. So we have somebody whose IQ is off the charts, but that person is not a particularly good salesperson because he's way or she way below the line. And now we have somebody whose IQ is about the same as Alex's here, but whose sales are great. So it turns out that if we want to get some empirical evidence for validity of our measure, we actually have to run a study. It doesn't have to be experiment. This is all correlational. But it turns out that IQ test is not a good one. We need something else. So in the textbook, they describe that the company invites a psychologist, a specialist, actually psychometrician as we call them, somebody who specializes in tests and assessments. This person designs a special questionnaire with whatever number of questions where when you administer that, you can see that Irina is very high on that measure of sales aptitude, I guess. And Alex is pretty low. And that's, look how tight the dots are compared to these guys. So this questionnaire, whatever it is, in terms of its criterion validity, is so much better than the IQ test because it brings empirical results that are predicted by the assessment. The other example that's in the textbook is SAT and ACT scores. I'm sure a bunch of you guys had to take these exams before you entered college. Presumably, SAT stands for Scholastic Aptitude Test, which means if you get high scores on SATs, you're going to be a great student. There is some truth to that, but not near way what SAT, which is produced by EST, Educational Something Company, Testing Company. So for example, many colleges these days don't even require these scores because they really, they give us a picture like this, all right, instead of having a picture like this. So do we have a good test for scholastic aptitude? Not really. That's, think about book smarts versus street smarts. We just have to continue to work on that. The BDI example I already mentioned, it has 21 items in its core, and you get to think about what is the face validity, what is the content validity, right? Are we having everything we need to assess depression? And does it have criterion validity? And there the answer is yes, because BDI has been used many, many times, and it produces the results that are expected in empirical studies of populations or samples from the populations. So it has all three. It has been tested and adjusted by experts for face and content validity, and it has been tested empirically among multiple populations of patients. And yes, people who are severely depressed come out with a very high score on BDI. I think that the maximum was 63, something like that. Finally, let's do these two, convergent and discriminant. To understand these things, you need to understand correlations. You need to understand scatter plots, right? So if you take one scale and you say it measures depression, and then somebody else comes and says, I also have a depression assessment. So if both of these people have created good assessments, what's going to happen when the same patient is measured by both of these instruments? Well, they should correlate, right? The higher the score is on one, the higher the score is on the other, giving us convergent, coming together, right? Convergent validity. Both tests claim to measure validity, and they do. And that's what you want. Of course, we have tons and tons and tons of different scales and measurements and measures and instruments. In fact, APA, is it APA or scientific, doesn't matter, let's say APA, publishes a yearbook of measurements every single year, because there's so many scales and questionnaires that are invented every year that you can publish a lot of stuff. So there are tons of questionnaires on depression. Okay, so for example, the Center for Epidemiological Studies here has a depression scale. You would predict that if it's a good scale, it should be convergent with BDI, because BDI is the best instrument we have since 1960s. Then the flip side is that if we are measuring something else, not depression, then the scores should diverge. That is, there should be a negative correlation between the two. The higher you are on depression, the lower you are on something else, which is not related to depression, or at least not necessarily lower, but not related. So BDI, Beck's Depression Inventory, does not have to be related to physical health. Well, of course, it happens that people who don't feel well are depressed. But there are plenty of very healthy people who are depressed, right? So in this case, if we're measuring health, we need to have something else. So we don't want BDI and that questionnaire to be correlated positively. We want them to diverge. We want them to discriminate between physical health and depression, mental health. All right, let's quickly do a couple of questions. So Judy finds a high correlation between her measure of intimacy and a measure of self-disclosure. Judy's finding would be an example of which type of validity? Okay, good, Jenny. Convergent, right. We want, if there is a high correlation, that means what she's asking about intimacy is very similar as when people are ready to disclose their sexual preferences. Perfect, good job, Jenny. All right, so you would be selecting B as an answer here. So here is my little tip in terms of doing multiple choice questions, not just for this class, for any class. So let me go back. Before you contemplate the answers, right, multiple choice, I know it's very tempting. Don't look at them. Try to answer the question first. Once you answer the question, then all you have to do is match. You have to recognize. That's easy. All right, one more, and then we'll have a break. So this is, oh, maybe there's two more. We'll see. That is from your quiz 2. Master student in school psychology is testing the discriminant validity. So now at this point, you could say, okay, discriminant, what does it mean if there are two different measures? Should they be positively related, or should they not be related at all, or negatively related? If it's discriminant, Jenny, you know the answer. Well, we don't have the word negative for validities, right? So in terms of correlations, should it be, yes, you said negative in terms of correlations, right? Yes, excellent, Vanessa. YD, which is the foil? The foil is an answer that's very close, but not the right one. And which are the two that you should not even consider? Yes, Vanessa, you're absolutely right. We can only consider negative correlations here because we're looking at the discriminant validity. So it's only B or D. Then the question is, why not B? Why D? Vanessa, do you have an idea? Anybody? Not just Vanessa? Rita, perhaps?
I think it's because D is lesser than B, maybe. I don't
Okay,
know.
well, that's obvious. You don't know. But why not B? B is also a negative correlation, right? Why does it have to be lesser than 1? Sever, what about you? What is your thinking?
I think I remember, like, whether it's a positive one or a negative one, if even if something is close to that negative one value, it's still I don't want to say important. For lack of a better word, like just like a valid source of information. Like it's a valid statistic as long as it's close to the negative one.
Right,
Figure.
right. So you said the correct words. You said that the correlation coefficient is bound between -1 and +1. That is, these are the absolute cutoffs. So to have a correlation of 1 means there's absolutely no variability. It's all perfect. And in real life, we never get those, ever. They just don't exist. So while -1 would have been the better value because it's bigger, it just doesn't exist. That's why D is the correct answer. It is showing us negative relationship between, what is he doing? Learning disabilities and mathematical versus verbal learning disabilities. Minus 0.83 is the correct answer because it's possible. It's what happens in real life. -1 never happens. So first you have to assess the sign. Do you need plus or minus? Because it's discriminant, it has to be minus. And then you choose between the two by saying which one is actually possible, which one exists, and which one doesn't, is not possible. And that's B. It's a theoretical concept that you can get to all the way to -1, all the way to +1. Normally it's always much lower. Okay, it's 5:35, so let's have a break until 5:40 and then come back and talk about assignment 2. To do the exercise. Mute my
Professor,
Yes, Jeremiah.
I missed the class about the discussion on assignment 2. For assignment
This
2,
is today.
huh?
This is today. This
Oh,
is today. This is happening now. You haven't missed anything yet.
okay. All right. Never mind. Thank you.
Okay. All right. So before we move into assignment 2, I have sent you by email, but also in the chat, an exercise. Where is that? Here, yeah, there it is. Okay, so you can use that for your participation points. So just create the new thread in your discussions and don't retype the whole thing, of course, just say A and then give me 2 answers, B, 2 answers, C, 2 answers. With these variables. In fact, if you learn, and don't forget that, until you get to 266, which is your next step in our curriculum, you then be very happy because knowing the variables is the first step in knowing which statistical test to do. It doesn't help you with doing the test itself, but you don't need to know that. We have JASP, we have SPSS, we have STATA, we have many, many different statistical programs, but the program won't tell you which test to do. You have to do it. And then it's just a matter of a few seconds. So use this. I haven't posted it as an activity because I thought we might do it in class, but certainly we don't have time for that. So use it as one of your participation points for this week. It will be the forum for week 6 will be open until Monday as usual. Oh, Monday, Tuesday, Monday. All right, now move on to assignment 2. Stop sharing. Okay, stop, the shared window is closed. All right. Okay, let's now look at instructions for assignment 2. They are already, let me do the attendance first. Some people I already know are here. So I know Jeremiah is here. Jackie, either say something or type here in the chat. No. Louis. Good, Louis. Thomas.
Oh, yeah.
Good. Cholani.
Here.
Very good. Monica.
Yeah, Professor, I'm here.
Good, Monica. Good. Eileen.
Here.
Milana. Not yet, Romain. You're coming towards the end of the list. Milana, you were here before. Did you disappear? Okay, if you're not present, you're not present. Devon Joy. Vanessa. Here, okay. Terence, not yet, you're coming. Chidima.
Yeah.
Thank you. Tara.
Here.
Very good. Very good. Irving. All right. Victoria.
Here.
Very good. Terence, now is your time to say something. You can type. Didi?
Here, Professor.
Did I call you? Yes, I did. Did she call me yet? Yes, I know you're here. All right. Yes, Didi, good. Alma? Here. Good. Callista? Okay,
I'm here.
Milana. Okay, Callista is here. Milana is here. She stepped out. Okay, good. Callista is here. Romaine is here. Brida is here. Seaver is here. Norma? Here. Very good. Irina? Our salesperson? Very good. Jasmine is here. Kim?
Here.
Very good. Edgar was with us, and hopefully, are you still with us, Edgar? Are you feeling okay? Joanna?
Here.
Very good. Sadiru? Okay, good. I see you, Edgar.
Here.
Very good. Tyrell? Lisbeth? Stephanie?
Here.
Very good. Skylet? Very good. And Janie, I know, is here. Okay, perfect. So let's now move on to, I'm going to make it larger so you can see better. Okay, can you see the instructions, guys?
Yes.
Thank you, Seaver. Okay, good. So in the beginning of this semester, I told you that normally I ask people, you guys, to do an observation, a naturalistic observation. And that's what I continue to say. However, if you think that your condition is such that you don't want to be sort of out and about because that's how you do observations, the other option would be a survey. And we would have to discuss that separately because the instructions are meant for observations. So let's talk about the observations first, and then you guys will try to perhaps have some brainstorming. This is what we're doing today. So naturalistic observation, this is the content of the second part of chapter 6, not the first one that we're doing next week, but the week after. It doesn't really matter because this is the easiest chapter of all. You may want to read the whole thing. It requires you to observe people's behavior in the natural habitat. So things that are not assumed to be public are off limits. And there is a famous case from 1970s where the team of people, I don't know, I want to call them psychologists. I guess in 1975, maybe it was okay. They observed men peeing in public restrooms. And the manipulation was, you have the urinals and the confederate would pee either at the edge of the urinal or in the middle. So the actual participant, yes, Jeremiah is funny. The actual participant then would not have so if the participant comes in, he doesn't know he's participant, right? He walks into the bathroom, he can take the urinal that is on the other edge in the first scenario. In the second one, he doesn't have a choice. He will have to do his business next to the person who's already peeing. So what they did, they measured without, I don't remember all the details. I don't think they sort of recorded their faces. They recorded the actual peeing process. And then they measured how long that person was peeing, because the question was, does a man get aroused in the presence of somebody else? It doesn't have to be a woman. It's just being next to somebody else. And of course, this is a public bathroom, right? It's public. One would assume that you could do all kinds of things. But we have an unwritten code about behavior in such circumstances. Now, we have now something very similar. We have cell phones where we can record everything and anything, and people have abused cell phones in locker rooms. I'm sure you have heard stories about that, or in other places where, yes, they're public, but they're not meant to be public. So we have to be very, cognizant about this. So the idea behind naturalistic observation, there are other types of observations, we're not talking about them for now, is to study behavior as it happens in the wild, so to speak. This is meant to give you hands-on experience in conducting actual psychological research. Some of my colleagues often teach this class and they ask students to do a thought experiment. Now, it's nice. I don't have nothing bad to say about thought experiments. But I know from my experience in teaching this class that unless you do something, you don't learn. You guys all had access to the textbook. You all read the chapter, and you all bombed quiz 2. So just reading or listening doesn't do anything. You actually have to do things with your own hands. That's hence assignment 2, which will take us 2 months. It will take us all the way to the end, to December 3rd. So here, I hope that you will be able to practice our entire flow chart for research process. We already looked at it on Tuesday because we moved to the designing stage where you have to identify participants, materials, your actual design, and your method, stuff like that. So here, hopefully you will understand how a naturalistic observation is conducted. And the reason why it is observation, because it's the easiest, the simplest. You will have a simple, hopefully, association claim that you will test. And you'll understand how it's done because you will have to physically do it. And then you should be able to explain that in your assignment 2 paper, which is going to be different from assignment 1 because this is going to be empirical. It will have a standard introduction, method, results, discussion format. And I'll post a few things for you to see. So here is our little timetable. Today is what? October 8th. And I suggest you do that. These instructions are posted to you on the Blackboard in assignment 2. And again, for now, I assume that you will be conducting an observation. But if you're doing a survey, we will have to do a few things differently. You have to have your observation plan, which is also posted on the Blackboard. I don't think we'll get to that now. Then you have to do 1 or 2 observations just to make sure that it works. Then you have to collect your data. All right, so all of these will be dates which you will put in. And then you have your data analysis, which we will align with November 17th, I guess just before Thanksgiving. We'll be doing data analysis, descriptive statistics and stuff like that. Nothing major, don't panic. We will do a chi-square, but I will create a template for you into which you'll just have to punch in 4 numbers. Then you have your report that will be submitted on December 3rd. And finally, you'll present it in a Zoom format to all of us on December 10th, which is our last. I think it's a Tuesday, right? No. Yes, or something. Whatever the date is. Maybe it's not the one. All right, so observation plan. Okay, saying that you should have an opportunity to study this behavior on Staten Island. But if you live in Brooklyn or Queens or New Jersey, it doesn't really matter. A lot of previous groups conducted their observations on CSI campus. So as I'm talking, I'm asking you guys to think of an association claim that is two variables that are connected, right? Without the causal verb, but variable one is likely to blah variable two, or variable one is linked to variable two. So that's your claim. So you need to think about you need to think about the behavior you're interested in, and then you need to think about the variable that can affect this behavior. So I already mentioned one group from last time. They looked at the traffic on the loop around our campus. Obviously, we don't go there anymore, so that may be out of question. But they looked, there is a bunch of stop signs all over the place. And when people drive, they often roll through these stop signs. Slowly, not so slowly. Very few people actually stop. So the question that they had was association claim, whether age, that is a proxy for experience, wisdom, if you want, is linked to the actual stopping at the sign. And the actual stopping at the sign for them was defined as 2 seconds minimum. That is, you don't roll through the stop sign, you actually stop. And then you roll. So, drive. So they actually positioned themselves at different locations on campus during the rush hour, usually in the morning when people come in for the 10 o'clock class, or around 6:30 when people leave. And they just checked, trying to see the face of the driver. Is it staff, faculty, or student, more or less. Two categories, that is a more mature adult versus younger adult, and then whether they stopped for 2 seconds or not. So that's the claim. These are the variables. So anything that is publicly visible. People have done observations in the malls, in grocery stores, in the zoo. I don't know if the zoo even open now. Maybe open, maybe not. Obviously, public transportation. A lot of people have done that. You have to decide. So you have to develop your own hypothesis. In this case, it's going to be an association claim that tests a relationship between these two variables, and then conduct your naturalistic observation to test it. So here's my example, dummy example is whether if you go to the gym, which we don't these days, whether people adjust the equipment depending on their height. So you can then have a hypothesis or association claim. Taller people are more likely than shorter people to adjust exercise equipment. And then you can test that hypothesis by observing people in the gym. That's legit because it's a gym. All right. So we need two variables. Now that's where it will pay off for those of you who were here on Tuesday. Our predictor variable, right, the one that affects the behavior, should be categorical. That is, it should be something with names. Hair color, eye color, standing in college, education level. These are all categorical variables because they have names. And then you need another behavioral variable, which will be also of categorical type. The easiest one is yes, no. Okay? So sometimes I'll call it grouping variable, which means it's categorical variable in the sense. You need to pick a behavior not only that is of interest to you, but also the one that's easily observed. So if you're thinking about some kind of attitudes, they're not easily observed, that's not a good thing. So think about physical things like walking, talking, sitting, whatever else you can see. And it cannot be now done at CSI campus, it has to be done somewhere else. Could be done in your neighborhood, could be done in the grocery store that you go for your groceries. If it is something that is very abstract, right, like aggressiveness, friendliness, freedom, right, you need to come up with an operational definition, right? And the operational definition for observation is going to be observational. If you're doing a survey, it's going to be self-report. There is no physiological option for us. Okay. Like here is somebody who did this observation once, where the people, depending on their gender, will hold the door for the person behind them. So they positioned themselves in 1P, I think, and they just watched whether men or women more likely to, I think it was called a chivalrous behavior or something, whether men were more likely to hold the door for whoever is following them, even if it's another man, than women. What else? These are a bunch of questions which you will look at. And the important thing is, which you need to start doing soon, is to find a relevant research article. Now you know how to do that. You're going to go to PsycInfo and you're going to type in your keywords and see what pops. So if you're doing stop signs and stopping behavior by drivers, then these will be the keywords for you to punch in. So I'm asking you to think about the date when you will have it, because if you don't have, sometimes you can find an article that's exactly what you are going to test. Usually it's not the case. It will be just close enough. It will be about your topic. Sometimes it comes from a completely different country, not from students. It's okay, as long as it is on these two variables. And then you will have to do 10 observations per person. That is, a group of 3 will have to collect 30 observations. A group of 2 will have to collect 20. Okay? And the normal, so the rule of thumb, that kind of behavior should be frequent enough for you to finish your data collection in 1 hour. So if you're doing something very esoteric, behavior that happens very rarely, you may be doing it for hours, and we don't want that. Let's find something that you can do under reasonable amount of time, knowing that we all are busy and it's difficult. And there will be a log sheet, which I will post this weekend. And then comes the actual report that we'll talk about later. So, for all of you now, we have 20, well, not even 20 minutes. So for all of you, what I would like to see is in the chat is your idea. That is 2 variables and how they are connected. At this point, it can be, you know, a fantasy. For example, a lot of you are interested in psychopathology, and I already told you many times that that's not something that we can do in this class. Maybe if you take 202, which is the psychopathology, or 203, which is child psychopathology, you may be able to do that, but even then I would be skeptical that it's possible. So forget about psychopathology. Think about normal human behavior. So I have the list of who's in class. I want to see everybody typing in something as soon as possible. And you can ask me questions, or you can unmute yourself and say, that's what I'm thinking about. Yes, 2 things, but they're not just things, Vanessa. They are variables, and one of them is behavior, a type of behavior. How people conform to their surroundings. Social status, mask wearing in New York City. Interesting. How would you, okay, Seaver, what's the operational definition for you for social status?
You know, this is not one of those instances where I want to like tread my words, because this has nothing to do with like race or class. This is like I see a lot of like I don't browse celebrity news and stuff, but a lot of like paparazzi photos. I'll see celebrities, particularly I don't know if it's staged, but either in New York or California, not wearing masks, like present day.
Mm-hmm.
So
Mm-hmm.
I've happened to be. I grew up in the city my whole life, but since March, I moved with my family to Long Island just because my parents have been on the older side. So I haven't really been in the five boroughs much since March. But when I
Mm-hmm.
do return back to Lower Manhattan once a month or so, I noticed like coming down on the Williamsburg Bridge, I'll notice like even on Delancey Street, maybe 80% of people wearing masks and maybe 20% of people not. And so there wasn't a particular demographic I had in mind necessarily, but I was just wondering if there's a correlation of like, do let's say rich people think that the rules or certain things don't apply to them. Like is there some correlation between? And I know it's like, how do we judge the wealth of someone? That
That's
might
right.
be.
That's exactly my question. I
Yeah.
can give you a little example from my work in Singapore. As perhaps you know, Singapore is a very wealthy place. So this particular group was interested exactly in something like that, whether the status is indicated somehow. So they decided to use as a status feature whether the person, usually men, would wear an expensive wristwatch. Of course, not an iWatch, but
Mhm.
something that's like Rolex or whatever. And you can see that because people roll up their sleeves.
Yeah.
So if you were to come up with something that would give you a good operational definition of a status of the person, then you're in business. But I think it's going to be problematic in New York to say who's wealthy, who's not. Perhaps if you
Yes.
wanted to do something on the masks, would be an easier thing is, some people wear just plain blue masks and other people wear
Mhm.
these masks with mouths and smiles and whatever. Is there any kind of a relationship between the type of mask and who, and I'm not saying who because I don't want to put my words in my ideas into your head, but what could be the variable that would affect the type of mask a person is wearing? Because now you may not even get enough people who don't wear masks because it's in the news again. So if you will be doing that, you will be in trouble because you're not going to get enough people to observe. But with masks, you could do something like that. If you have any ideas, have you seen people sort of distinctly separating themselves by the type of mask they wear? Is it N95? Is it this plain one? Is it the fancy, there are now expensive,
Mhm.
beautiful masks. I don't think we'll see them on the street, but like graphics, cloth versus, I know that a lot of young men in my neighborhood wear just bandanas,
Yeah.
not really a mask, right? Okay, good. So keep thinking. I want to see. So I see Jeremiah. Okay, Vanessa. What does Vanessa say? Vanessa, would you want to unmute yourself and give us a little, if you have a mic, a little thinking on your part? I'm still thinking. Okay. Luz, how about you? Do you have a mic? Nope. Sorry. Okay. Didi says stress and emotional eating. I saw a short film on how people claim their emotional eating got worse due to the stress brought on by the pandemic, which means, Didi, you'll have to go to a place where people eat. And
I,
um,
I don't need to
yeah,
interject.
mostly outside now, but it's getting colder. So
Is
I
it
don't know.
to ask the people, like if I get in contact with somebody and ask them, like, um,
I think the only way you can do questions these days, Didi, is only by email or by text. By texting, I don't think people will be willing to talk because
mm,
it's the time that nobody's very comfortable.
Yeah.
So if you decide to go for a survey, which is what you're talking about now, then we'll have to create a survey on SurveyMonkey, and you will have to distribute it to your, friends or, relatives, classmates, whatever. You can use each other. That's not a problem. So Alma says the mall and people social distancing. Okay. Hmm. Well, our social distancing is 6 feet. If they move, Alma, it's not going to be easy, right? To sort of think about the 6 feet distance. If they're in line, but then most of the lines now are being directed by these decals that are on the floor. So people
Yeah,
will
I
be.
work at the mall, so when I like
Uh-huh.
go to like get lunch or something, like I notice
Uh-huh.
that people aren't necessarily stepping on the decals on the floor. And like if the
Oh,
person,
interesting.
yeah.
Uh-huh. Uh-huh.
So like
Okay, so
sometimes,
then go ahead. Sorry.
sorry. So I remember one time I was going to get lunch and this lady was like really, really close to me and I was like, yo, excuse me, can you back up? And like she was so mad at me and I was like, oh my God, like I'm sorry, I just, don't want to catch corona.
Yeah. Did you see? I saw, heard about it, I think, on the news that a guy in the bar, I think in Brooklyn, asked one of the patrons to put the mask on, and he was pushed so hard that he died. He died because he asked somebody who was not wearing a mask to put the mask on.
That's
This
insane.
is,
That's
it's totally
crazy.
insane. I agree. But
People get
Alma, I
so
kind of like
mad.
people get so mad, right? But
Oh.
now, Alma, if this is the behavior that we are measuring, and you can do that because you are working in the mall and you see that, what is the variable that affects whether the person is standing on a decal or not?
What do you mean?
Well, remember, we have to have two variables that connect to each other, right?
Mm-hmm.
So you're saying the mall and people social distancing, but the mall is the location. It's not the variable. If you were to say, I will compare people lining in the mall with people lining in, I don't know where, at McDonald's or something, or Starbucks,
So
then
I could use
mall
like the
versus
food.
Starbucks.
I could use like the food court and then my job specifically, because like I work in like a jewelry store and then the food court would just be like a
Uh-huh.
bunch of people working in food.
Okay, but you still are not telling me what the variable will be, the one that will affect, in your opinion, whether the person is standing on the decal or not. You're not going to ask them, say, why aren't you standing on the decal, right? You will
That's
just have to
true.
observe them. So what is the variable? Do you think that women are more likely, or children are less likely, or older people are more likely? That's the predictive variable. That's the one that's missing in your idea. Think. Okay, Callista, see how many people use the hand sanitizer pump. Okay, Callista, for now, your idea is a frequency claim. That is, you're just going to say, out of 100 people, 60 used it. Remember, we're trying to do an association claim, not a frequency claim. So what would be the variable that you would predict affects whether people are using sanitizer or not? Stephanie says, irritable people in grocery stores who argue when they don't have masks. Okay, what are the two variables, Stephanie? Wear mask, not wear mask. Okay, that's the behavior, I understand. What is the predictive variable, the one that affects the behavior? Do you think younger people are less likely to wear masks than older people?
I work in a grocery
Uh-huh.
store. So I see it firsthand, and I don't know, because it's kind of both in a way, because I come across younger and older people that don't have masks, but I'll go up to them, because our store, you can't be walking around without one, and we do provide if you don't have one. So I'll approach someone and be like, you need to wear a mask to shop in here. And some people give me no problem. They'll be like, oh, I completely forgot, I forgot it in the car, this and that. And I'm like, no worries, we'll provide you one. But then some people just completely like bug out, and
Okay, good. Okay, if you were to go this way, now you have to educate me or anybody else and say, why do you think that certain categories of people are less likely to wear masks? And what is that category? I suggested age and you say, no, it's not age. So what is it? You have to connect two variables, Stephanie. That's the idea.
Okay. I'm gonna
See what I mean?
yeah.
Think about it. Not a problem. All right, so let's see. Victoria says, observe men and women getting gas at the gas station. Okay, some women have an anxiety to go and pump the gas to their car. They're just afraid of doing that. On the other hand, men have no such issue. Okay, so it's a, and how would you, Victoria, how would you assess whether the person is anxious? We need an operational definition. I mean, gender is easy, right? But anxiousness, anxiety, right, is not easy. Somebody who is sort of flailing around the gas pump, trying to push the buttons, or just standing there forlorn, is that the... Okay, I think about it. Good, good. All right. Who else has an idea that we could discuss? Callista says, children, teens versus old people. Who uses the hand sanitizer given at the mall entrances, exits? Okay. Children. No, no. Children usually behave or do whatever parents, you mean teens, older children who are there by themselves. Okay. So you predict, Callista, that teens are less likely to use hand sanitizer than older people, right? Okay. Because they are more reckless, I guess. Potentially as a promising idea. What age group of people is more likely to wear a mask? I think, Cholani, that's going to be a little bit difficult because there's a bunch of confounds here. Age and speeding. Ah, okay. You mean in car, right? Driving. Yes, Eileen. Are you talking about the... Does time... Okay, so tell me, Eileen, what you think about speeding. What you mean by speeding. Does time of day affect how polite someone is? I'm thinking variable would be the time of day, and politeness would be measured on a scale from rude to very polite. And the problem, Louis, here is that there will be too many other things that can affect your politeness, right? You can be very irritable in the morning if you didn't sleep well or something. Going with my example, Stephanie says, I think younger people are more likely to not wear it because of this feeling of entitlement. I think trying to look at the numbers of people who don't wear masks might be a bit difficult now, just because it's back in sort of in the zeitgeist, as we say. Zeitgeist is something that is very current. So it probably will be better if you focus on the differences, not in wearing, not wearing mask, but maybe, do you see people pulling it down on the chin or letting the nose out with the mask on? Because so few people are now... I think I missed Irving's idea. Let's see. Let me go back. Irving says spanking. Remember, Irving, we are observing behavior. I don't think, unless you have a child that you spank yourself, I don't think you will be able to observe that. So that's a very different study. That's going to be something like a survey, but I doubt that people will be honest about this. All right, let's see. Parents who talk a lot with their kids in their childhood, their kids are more likely to start talking early. Okay, read that. Again, that's not an observational study, right? Because now you're talking about children who are already older and whatever conversations they had were in the past. So it's not an observation. It would be some kind of a survey. But parents are notoriously bad at remembering any of that unless they're linguists like me. I can tell you when my son said his first word. Oh, my daughter. Okay, we are at 6:20, guys. Thank you for a lively conversation. That's what you need to discuss now among the three of you for next Thursday, because that's when we start doing the observation plan. Or if you decide to go with a survey, I'll have to perhaps train you a little bit more than just this stuff. Everything will be posted. So thank you for participation. The class is over. I'll see you next Thursday. Yes, Stephanie.
We're still in the same groups as we were.
Unless you don't like your group and you want to switch.
No, I like my group.
Good. That's it. Good night, Norma.
Take
care,
you.
Stephanie.
Have a good weekend.
Okay.
Thank you. Have a
You
good
too.
night.
Thank you, Professor.
Take care,
Good night,
guys.
everybody. Good night.
And you. Good night, Seaver. Bye, Kim. Bye, Louis. Bye, Dee Dee. Jeremiah, feel better. Don't get sick.
Professor,
Okay,
I
Rita.
have a question.
Very good. Let me just close all of this. Oops. Yes. Give me a second so I can open the. Yes. Go ahead.
Okay, so I checked my grades, and then it says that on September 1 and 3rd discussion board, my score is 1 out of 3. But for the other ones, it's they all are 1 out of 1. So I want to know, like, what are the two, points deducted for?
Okay. So what you need to do is to go back to your discussions and tell me which date they were posted on. It's possible that I missed something. I just have to check. But I don't want to check all your threads. I just check the ones that you think are
It's for September 1
misgraded.
to 3. September 1 to 3. It's for that one.
Okay, just this one. All right.
Yeah,
I'm gonna
it was
write it
just that
down
one.
and check.
The score is
Okay.
1 out of 3.
1 out of 3. Okay. So Rita, Sept 1 to 3. Check. Discussion. Okay, we'll let you know.
All right. Thank you so much.
Take
Have a
care.
good night.
You too.